When it comes to breasts and breast health, myths abound. From old wives' tales whispered between generations to viral misinformation online, these misconceptions can shape how we view our bodies, influence our health decisions, and even cause unnecessary anxiety or complacency. It's time to set the record straight by debunking some of the most common breast myths with facts, empathy, and clarity. One of the most persistent myths is that wearing underwire bras increases your risk of breast cancer. This idea, which gained traction in the 1990s, suggests that underwires impede lymphatic drainage, causing toxins to accumulate in breast tissue. However, extensive research, including studies by the American Cancer Society, has found no link between bra type and breast cancer risk. The lymphatic system is not so easily obstructed, and cancer is a complex disease influenced by genetics, lifestyle, and environmental factors, not your choice of lingerie. Another widespread misconception is that only women with a family history of breast cancer are at risk. While having a first-degree relative with breast cancer does increase your risk, the majority of women diagnosed have no family history at all. In fact, most cases are considered sporadic, meaning they occur due to a combination of aging, hormonal influences, and random genetic mutations. This myth can be dangerous, as it may lead those without a family history to skip regular screenings or ignore warning signs. Regardless of family background, regular self-exams and mammograms, as recommended by your healthcare provider, remain essential for early detection. The belief that small-breasted women are less likely to get breast cancer is another myth that refuses to die. Breast size has no bearing on cancer risk. The disease develops in the cells of breast tissue, which all women and men possess, regardless of cup size. Similarly, the myth that men cannot get breast cancer is both false and harmful. While rare, male breast cancer does occur, and awareness is crucial for timely diagnosis and treatment. Men should also pay attention to changes in their chest area, such as lumps, nipple discharge, or skin changes. Many people think that finding a lump in your breast automatically means cancer. In reality, most breast lumps are benign, particularly in younger women. Conditions like fibroadenomas, cysts, and fibrocystic changes are common and usually harmless. That said, any new lump or change should always be evaluated by a healthcare professional to rule out malignancy. Conversely, some believe that if you don't feel a lump, you're in the clear. Not all breast cancers present as palpable lumps. Some are detected only through mammograms or imaging, underscoring the importance of regular screening. There's also confusion around breast pain. Many assume that pain is a sign of cancer, but breast pain is rarely associated with malignancy. Cyclical pain linked to menstrual cycles, hormonal fluctuations, or benign conditions is much more common. However, persistent, unexplained pain should still be checked by a doctor to rule out any underlying issues. Another myth worth addressing is the idea that breastfeeding prevents breast cancer entirely. While breastfeeding does offer some protective effect, especially if done for a longer duration, it is not a guarantee against developing the disease. Breastfeeding is just one of many factors that can influence risk, alongside age, genetics, reproductive history, and lifestyle choices. It's important not to rely solely on breastfeeding as a preventive strategy. The notion that wearing a bra to bed is harmful also circulates widely. Some claim that nighttime bra wearing restricts lymph flow or causes sagging, but there is no scientific evidence to support these ideas. Whether you wear a bra to bed comes down to personal comfort. It won't affect your breast health or shape in the long run. Speaking of sagging, many women worry that certain habits will cause their breasts to droop. While gravity, aging, pregnancy, and genetics are the main contributors to breast ptosis, sagging, everyday activities like going braless, exercising, or breastfeeding have little lasting impact. In fact, wearing a supportive bra during high-impact exercise can help prevent discomfort, but it won't alter the natural aging process of breast tissue. Misinformation also thrives around mammograms. Some fear that the radiation exposure from mammograms increases cancer risk. However, the amount of radiation used is extremely low, and the benefits of early detection far outweigh any minimal risk. Others believe that mammograms are only necessary for older women, but guidelines recommend starting regular screening at age 40 or earlier for those with higher risk factors. Early detection remains the most powerful tool in improving breast cancer outcomes. It's also commonly believed that injuries to the breast, such as bumps or bruises, can cause cancer. There is no evidence to support this. Trauma may draw attention to an existing lump, but it does not cause cancer to develop. Similarly, using antiperspirants or deodorants has been wrongly implicated in increasing breast cancer risk due to concerns about aluminum compounds and toxins. Multiple studies have found no credible link between these products and breast cancer. Finally, let's address the myth that breast cancer is always visible or obvious. Not all symptoms are dramatic or easy to spot. Subtle changes, such as dimpling of the skin, nipple inversion, redness, or unusual discharge, can be early warning signs. Education about these less obvious symptoms is vital for everyone, regardless of gender or age. In summary, myths about breasts and breast health persist, fueled by fear, misunderstanding, and sometimes wishful thinking. These misconceptions can delay diagnosis, create unnecessary anxiety, or foster a false sense of security. The best defense is knowledge, understanding the true risk factors, recognizing the importance of regular screenings, and consulting healthcare professionals when in doubt. By debunking these common myths, we empower ourselves and others to take charge of our breast health with confidence, clarity, and compassion.